Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
Depends on what type of pain pills there are. So if it's an opioid you're using for pain relief, it's very dangerous because of addiction potential. Also, it's not doing anything to treat the underlying cause. It's doing nothing for the inflammation, nothing for the cartilage. All it's doing is masking the pain, making you more prone to addiction. If you give them an opioid, it's going to make them more unsteady, more prone to fall. If they fall, they can hit their head, they can fracture their hip. I mean, if you fracture your hip, you have a 1/3 chance of dying within a year. It's crazy. You can't drive a vehicle. You can't use heavy machinery. You shouldn't work if you're on an opioid. Other type of quote unquote pain pills are mostly anti-inflammatories, non-steroidal anti-inflammatories, NSAIDs, but there's also Tylenol, acetaminophen, which is not technically an anti-inflammatory. So it's strictly a pain reliever. And it's pretty safe if you use it within the dosages that you're supposed to. If you use it more than you need to, it can affect your kidney and your liver. And some people are allergic to it. But for the most part, Tylenol's pretty safe. I mean, think about it. How many of you out there have used Tylenol? It doesn't really do, most people, it doesn't help their pain that much. If it works, awesome, because it's relatively safe, but it's not doing anything for the underlying problem. It's not treating the root cause. And there's all kinds of different non-steroidal anti-inflammatories. What they do is they decrease inflammation. So kind of like cortisone, they decrease inflammation, but they have to circulate through your whole body in order to do it. Most and many of them can affect your stomach or your GI system, lead to ulcers, bleeding, indigestion, things like that. There are some like Celebrex, and there's a couple others that are, quote, gentler on the stomach, but we do worry about the effect on the GI system. And if you take them for too long, they can affect your blood pressure, your heart, same thing, your kidneys, your liver. And so we really don't want people on those for long term. There's a lot of side effects. Again, they're masking the symptoms. They're not doing anything for growing back cartilage or treating the underlying problem. And they can be expensive. All these things add up over time if you have to buy them, purchase them, co-pays, even the prescription ones. Somebody might have stress or microfracturing in their bone. That's kind of another topic, but when people get arthritis, the pain actually comes more from the bone getting soft underneath the cartilage. And as the bone gets soft, there's not as much support for the cartilage, and the cartilage starts to break down faster. And then as the cartilage breaks down, more and more force gets transmitted to the bone, and the bone starts to break down faster than the body can heal itself. And it gets softer, and then there's less support for the cartilage over the top, and you get into a vicious cycle, and the knee starts to degenerate more. Well, interestingly, non-steroidal anti-inflammatories inhibit bone growth. So the last thing you want to do if you have stress or microfractures is take something that's going to make the bone even less prone to healing. So we don't like it for that reason, being orthopedic surgeons either, because it can negatively affect bone growth and bone healing.